Why don't I start with just an expanded explanation of what we will be experiencing in 2013. Effective 10/1 of this year, the exchanges will come up live. This is what's being planned by the government right now as we speak, for a 1/1/14 effective date. On those exchanges on 10/1, there will be multiple products listed on the exchange where individuals will have an opportunity to choose based upon the plan that best meets their needs, their benefit package that they want to purchase. They'll have an opportunity to apply for that plan online for a 1/1/14 effective date. Again, depending upon your ability to pay will determine how much you will pay personally and how much government assistance you'll receive as part of your premium assistance. So there will be significant premium assistance provided you purchase your insurance on this health information exchange. It's called a marketplace now. So with that in mind, there's significant change. I think we'll see a very noisy summer. There's money in the Affordable Care Act that provides the government an opportunity to do a lot of advertising. So you'll see a tremendous amount of information being pushed out in the marketplace this summer. I think you'll see, in addition to people in coalitions and associations and drugstores who are trying to help their customers understand and navigate all these changes, you'll see the competitive industry, ourselves and others who are introducing products on the exchange out this summer trying to encourage people to purchase their products on the exchange. So I really believe that we're in for probably an unprecedented amount of information overload in a very short period of time, trying to prepare everyone for a 10/1 date. And that's why it's so critically important that we have the Education Coalition out making unbiased information available to various stakeholder groups and the members that you serve, to give them as a trusted advisor a place for you to go to receive information. So that's it. It's a huge task. We have an opportunity, as I see it, to take advantage of a lot of reform that's going to occur over a short period of time, build a better system, a better way for Americans to access health care, and bring some stability to the premiums and the cost of health care in America today. Questions? Mike?
Mike, Blue Cross is probably the best connected organization in terms of healthcare financing in the state right now. As a starting point today, where do you see the Joe Q citizen, Joe Sixpack, in terms of understanding what's happening, not understanding it? Are there pockets of understanding? Kind of where's our starting point? What do we need to do?
Yeah. Well, we've been working at this, Mike. Thanks for the question. For over a year, we have a very professional distribution, many of which were represented here with us today. Our brokers are out talking to group leaders, talking to individuals now, exploring the various options for them to consider as more and more rules become finalized and we see a clearer path. I think our employers will be going through an exercise of trying to determine whether or not we maintain a group health insurance plan or not. But the average individual, Joe Sixpack as you refer to right now, I don't think they have necessarily a clue as to what's coming down effective 10/1 insofar as an opportunity for them to purchase insurance. But again, I think with excellent media outlets, excellent coalition partners, we'll have a great chance for us to close that gap. Yes, sir.
Mike, we had a big debate here in New Orleans regarding the Times-Picayune going digital. Now, you're talking about the website, and I certainly am very technology dedicated. But how in the world is Joe Sixpack going to be able to, one, get to a computer, secondly, know what they're doing and understand what they're doing?
Yeah. That's a great question. Ron, if they call them solicitors,
Navigators.
Navigators. There will be navigators financed by the government whose purpose it is to work with individuals via telephone, walk them through a website, try to find the most appropriate means for us to educate and enroll people on the exchange. So while it may sound very confusing, I do believe that the navigators will be publicized. People will see where to go in order to receive some unbiased help on what plans are most appropriate for them and how best to enroll in that particular plan. So the government did foresee the need to put more people in more places of influence to assist individuals who aren't quite as tech savvy.